All right, hi everyone. I wanted to show you how to get your fluids ready for a dental procedure here at Carrington College. So for any dental procedure, we are going to choose this fluid pump with this Heska manufacturer for our fluids. So we already have a bag that we spiked already. So we are going to pretend that our fluid rate for our patient is going to be 8 mils per hour, okay? And we want to make sure we put the proper settings on here. So because of the size of our patient, we're going to be using a micro drip set, okay? So we first want to untangle our drip set and our extension set. And as you can see, this is clamped already. Okay. And I want to make sure that the little cap on this end does not get dropped. If that accidentally does happen, we can just grab a sterile needle and use that as a placeholder, okay? Now, we want to open this up. We just press this little button right here, and that will open up the little door, okay? We always want to make sure our clamp is on this end, and look at the arrow. It says flow direction that way. So we want to feed our line that way. So I'd like to give it a little push like that. Okay, once I close this door, the Heska pump is going to clamp our fluids, okay? So I'm gonna go ahead and do that. And now I'm going to unclamp this. Just like that. Okay, so I'm gonna keep a hand on this. Now I'm gonna turn it on. So we have different settings on this side. So we have our rate, our time. We're always going to set the time to 3 hours. VTBI means volume to be infused. VI means volume infused. And let's look over here. So for surgery lab, the words that we, or the letters that we are concerned about on this side is macro and micro. So I said in the beginning that this is going to be a patient who is going to get a micro drip set. And look at here, it's highlighted in green, micro or mic, okay? So I'm going to keep that there. And I said my rate was going to be 8 mils per hour. So I'm gonna use the top arrow here to change the number. And do you see how we are at the 10th place here? That is fine, but just so you guys know, if our mils per hour is past 10, we can no longer round to that 10th place anymore, okay? So we can only do 10, 11, 12, 13, 14, 15, and so forth, okay? But we're gonna go back down to 8. Perfect. Now I'm gonna hit select in order to move my green color to the other letters over here. So I'm gonna hit select. Now we're at the time. We wanna set that to 3 hours. Oops, right there. Now I wanna move on to the VTBI now. Okay, so that, because I did 3 hours, the volume to be infused is 24 mils because 8 times 3 equals 24. So the machine did the math for us already. And then we're gonna go to VI. Remember, VI means volume infused. We have not infused anything to our patient, so we need to make sure that this number is always 0. So in order to remove the 37.2, I just hit clear. Perfect. And then what I want to do is I want to click a sequence of buttons in order to save my information, okay? So when it's time for this pump to be used and I can connect my fluids to my patient, it is ready to go. I do not have to put any of the settings here anymore, okay? So I'm gonna hit run, hold, off. That will save my information. So when the time comes, I hit on. And I want to keep hitting run till I see lines on this side going up and down. Let me show you. Run, run, run. Look at those lines. That's what we want to see. That is when you know the pump is working and the patient will be receiving these fluids. I'm just going to go ahead and save my information. Run, hold, off. And that's the way we input our settings using the Heska fluid pump.